Dr. B here with our series in Demystifying the DSM. Today I'm going to talk about major depressive disorder, and it's kind of ironic to only be doing a 5-minute video on what is the most prevalent diagnoses that we see in our clinic. So many people are struggling with depressive symptoms, and so I want to really help our listeners differentiate depressive symptoms in depressive disorder, major depressive disorder. We all experience symptoms of depression, of extreme sadness, and we often use depression as a adjective on, how you feel. I feel depressed. I'm personally, if you follow my story, you know that I'm personally grieving the loss of my daughter recently. And I have moments where I am depressed. I have not recently met criteria for major depressive disorder. And what I want to do here is help distinguish when you actually meet criteria for major depressive disorder, that there is treatment. And, oftentimes, people will say, well, I don't want to take medication. I don't necessarily need it. And some of the previous disorders that we've talked about in this series probably need medication, right? There's a biochemical problem in schizophrenia. There's a biochemical problem in bipolar 1 that really needs to be addressed from a chemical standpoint. Depression, there's also a biochemical component, and some people are predisposed to that and have it without stress. But then there is this threshold that we can all get to that puts us to the point where our neurotransmitters are not functioning well enough, right? So it's okay to, even if you don't have this predisposition, even if you feel like maybe your depression's not bad enough to need medication, just think, what if there was something that would help you to be able to choose happiness more often, and to get out of bed on a Saturday and do something fun, right? So there is a strong cognitive behavioral therapy component to treating depression, but it's okay to also take medication, okay? When you get to the point of actually meeting criteria for major depressive disorder, I do want you to consider taking medication. So some of the things: depressed mood most days or nearly every day, a marked diminished interest in things that typically were pleasurable for you, any significant weight loss, insomnia or hypersomnia, like sleeping too much, feeling agitated or excessively fatigued, feelings of worthlessness, hopelessness, helplessness. If you have 5 or more of those symptoms, please consider, actually medication treatment, or at least getting an evaluation for that. So those are some of the symptoms for major depressive disorder. And one of the things that we talk about as well is that point of feeling like you want to hurt yourself, or even kill yourself, feeling suicidal. If you are at that point, if you feel like hurting yourself, if you're cutting yourself, burning yourself, doing some other kind of self-mutilation, or you feel like you want to die, that is the point that is non-negotiable for me. You have to consider medication. Your neurotransmitters are too low, and you need to bring those up. And for major depression, oftentimes, if you've had 2 or more episodes in your life, we do recommend you staying on antidepressants indefinitely. But I would always, talk that through with my clients. But in that first episode, 6 months, a year, and then you can take a trial off medication. So that is specifically major depressive disorder. And how we treat it at Mentally Strong is you'll come in and get a full psychiatric assessment. We would set you up with a counselor that would do the Mentally Strong method, right? If we change the way we think, we can change our choices, right? Sometimes that depression is coming from this negative internal dialogue, the way that you're talking to yourself, and we're going to help you reframe that and find those positives so that you can make the choice to go out for a walk on a sunny day, or you can make the choice to exercise, which would naturally bring up those neurotransmitters, right? So finding that balance. But if you meet criteria for major depressive disorder, please get an evaluation, get some treatment. You deserve to be happy.